So diagnosis, again, some pictures that David Bentley has very kindly let me have. The picture on the right is quite difficult. I've tried to take good photographs of how a woods lamp works, but it's often quite tricky to get a photograph. But I think you can all appreciate the fluorescence there. And when you're using a woods lamp, you need to be aware that, one, it is only M. canis that will fluoresce, and we know that probably only about 50% of M. canis strains will actually fluoresce as well. So it's a nice screening test, but please don't think that a negative means that your cat or your dog doesn't have ringworm, because it is certainly possible for it to have it and have a negative woods lamp test. When you're looking through the woods lamp, you should see an apple green fluorescence, and you should see that that is coming from hairs rather than from scabs, because the scabs on the whole will not fluoresce or will not have ringworm on them. It's the hairs that you're really looking for. Again, a picture from David shows the spores around an infected hair, and then also, depending on what your fancy is, I send most, if not all, of my fungal cultures to the laboratory, but this is showing the change in colour on a DTM plate from yellow to red at the same time as the white colonies appear, and we'll show you that in more detail in the next slide. So in-house dermatophyte test medium is worth having if you are keen on your laboratory work. It contains a nutrient medium, it contains a colour indicator, and it also has an inhibitor in it to stop the growth and multiplication of bacteria and saprophytic fungi. And you can get it in several forms through your suppliers. And as I said, the white colony and the red colour come at the same time. If that doesn't happen, there is a good chance that you have something else growing, maybe a saprophyte, and you can obviously get false positive M. canis and other infections. So if you're not sure, it is always best sending it off to a commercial lab. To actually fungal culture a cat, a number of methods that we can use. Sometimes I just like to collect scrapings, pluckings, comb the cat thoroughly over its body and take some hair from it and put that into a piece of paper, fold that over, and then put that into an ordinary envelope, not a plastic one, because if it then takes about a day to get over to the lab, the plastic will cause the humidity of the sample to change, and you're more likely to get an overgrowth of a saprophyte. So you're best to just put it in an ordinary paper envelope and then send it off to the lab, who will go on to test it. The other method is to use the Mackenzie toothbrush technique, which is to take a clean toothbrush, to comb the cat thoroughly all over its body, and then to send that toothbrush either to the lab or to use that toothbrush to inoculate into your DTM plate, agar plate. This can be kept sorry, I should have said incubate at warm room temperature, and it should be examined daily, because changes can happen quite quickly. Usually it takes sort of 7 to 14 days to happen, but you should be watching and making sure that you see the colour change happening at the same time as you see the colonies. And of course, as we've just mentioned, confirm microscopically.